Welcome back. Over 2 months ago, I proposed healthcare premium relief for Minnesotans who don't qualify for the federal credits under the Affordable Care Act. And unfortunately, we were not able to reach an agreement to proceed thereafter. So I'm calling on the legislature to this week pass the bill that I proposed before, which I'm very grateful to Representative Liebling and Senator Lourey for sponsoring, that would provide this relief to about 125,000 Minnesotans who otherwise are not receiving any assistance with the premium increases that they've received for this year. Is time urgent because the open enrollment period ends January 31st, and Minnesotans are still making decisions about what level of health care coverage they can afford. So knowing that they're going to get this relief is just vitally important to their decisions, and we need to act on it immediately. So that'll defer to Representative Liebling and Senator Lourey.
Well, I mean, I think that the governor stated it pretty well. There are a lot of Minnesotans who are trying to make informed decisions about their health care choices right now. There's been a lot of talk about this bill. This is the bill that has been bantered about in the press and around with the negotiations with all four caucuses, and I think there's quite a bit of agreement around it. I'm really glad to be bringing it forward, and I hope that we're able to actually engage the entire legislature in passing this relief for people. I think the governor's point about open enrollment does continue till January 31st is one that we need to make people aware of and make sure that if we can get these subsidies secured, that people make the best choices for the coverage options that work best for themselves and their families. And I'm glad to be bringing this forward and hope that we can do in this first week what we were not able to do in a special session.
Good morning, everyone. It's really great to be in this beautiful, refurbished room and be back in the Capitol. So I think, of course, I agree with what's been said. I'm very pleased to be able to introduce this bill and to carry this bill in the House. You know, this is something that House Speaker Kurt Daudt has been talking about for a long time. Before the election, he said he was going to call on the governor to resign if the governor didn't solve this problem. So when the governor came forward with a solution, an immediate solution to help these families who are really in deep trouble, some of them, because of these sharp premium increases, it wasn't good enough for Kurt Daudt. So when the Speaker came forward with a bill, that bill had in it part of what the governor is proposing. It had the 25% rebate, but only for the first 6 months. After that, it simply said, okay, administration, you decide how to make this proposal better. So it wasn't quite good enough for them, but they didn't have a solution. They simply engaged in magical thinking. This is something we've seen but I'm afraid that we will, where a solution for the GOP is to say, somebody else figure out how to solve the problem. That's not leadership. It's time for the GOP to stop blaming and complaining and lead. And leading doesn't mean saying, here, Governor, you solve the problem for us. There is a solution. It's in this bill. It is in no way perfect. But what it does is bring immediate help to people who really, really need it and buy us all time to try to figure out a longer-term solution. And that's why I'm very pleased to support this bill. It is not a perfect solution by any means, and I'm sure the governor even agrees with that. None of us think this is a wonderful way to move forward, but it is a way that will work, that will give immediate relief to the people who really need it. So thank you very much.
And just to clarify, this bill would provide, as Representative Liebling said, a premium rebate of 25% of the total, not just the increase in their premiums, but the total premiums, which will bring the increase down on average to about the range of up to 9%, just a little bit over that, about 11% on average, that the Affordable Care Act tax provisions provide for those who qualify. And I would ask the legislature to send this bill as it is, because if you add a lot of the other features that were proposed in the last days of our negotiation over the special session, they're measures that frankly need to be considered by the legislature in the due course of time, with public hearings and a chance for people to express their views, the pros and cons of these recommendations. If they can find a way, and I've said this for 2 months, to provide get the health plans to provide continuity of care so people can keep the doctors they had up until this time, I'm all for it. If they can accomplish that, more power to them, and be glad to include that. But I would hope that the rest of the modifications and ideas people have for quote unquote reform of the Affordable Care Act, and as it applies in Minnesota through MNsure, that those can be taken up in due course of the legislative process to give them the careful public vetting that they need before they're voted upon. Now we can respond to questions.
What's your latest assessment of the cost of this to the state treasury, and would you take that money from the healthcare access fund or the surplus?
$313 million is the current estimate. I would propose originally to come from not taking the money, the November forecast shifted to the budget reserve, which is a little over $300 million. Yes. That was remains my first choice. Speaker Dowd has said he wants it to be the Healthcare Access Fund, which I'm willing to agree to in the spirit of compromise. I think that I prefer my approach, but I'll let the legislators speak for themselves on that.
Well, I agree with the governor. My strong preference would be a general fund funding of it, but in the hope of actually getting it done and accomplished rather than having additional issues to argue over. We're going to come out with the bill that proposes we take it from the Healthcare Access Fund surplus that is sufficient to cover these costs.
Governor, can you put this, I'm sorry,
No.
Governor, can you put this in some sort of context for us? How urgent is this to get this done, and how soon are you asking that it be completed so you can sign it?
Well, I proposed it at the end of October, so over 2 months ago. It should have been enacted then, or right when the open enrollment period began, November 1st, so that people making these decisions about what kind of health coverage can they afford would know they're going to get this premium relief. And now we're 2 months into that open enrollment period, which concludes on January 31st, and that we still haven't taken any action. The people out there are left to have to assume they're not going to get any assistance unless something's forthcoming, and that means they can afford a lesser quality of health care insurance than they would be able to with this assistance. So it's time urgent, and that's why I urge the legislature to pass this bill this week.
Has anybody from the leadership in either body told you they will pass it this week?
When I had lunch with Speaker Dowd last week, he expressed his strong desire to pass it, a recognition of the urgency, time urgency, given the close of the open enrollment, but I'd have to defer to him in terms of how he intends to proceed. Same with Senator Gazelka.
Senator Lourey, have you talked to the incoming majority leader about this?
I talked with Chair Senator Benson just a few minutes ago and let her know that we were doing this, and she said we should sit down and have a talk about it. I know that prior to the session starting today, Senator Gazelka has expressed a great deal of interest in the urgency of this and had, by all reports, said that he was willing to do this as a standalone bill in the special session. Again, that didn't happen, but I think that bodes well for a willingness to actually start to engage on this, and I hope that we're able to deliver on that.
In terms of implementation, when you're looking at the billing cycle or the dates, I mean, how might an extended delay push out the implementation of any solution, whether it's passed by the 6th or the 15th? Because I understand plans might need some time to implement it for the next month. But sort of looking forward, what might extended delays do to implementation?
Well, the proposal is for 1 year, and if it had been enacted when I proposed it or shortly thereafter, it would have been ready to be implemented starting with people's January billings. Can we make February now if it were past?
I don't think so. I mean, it would have to be.
So March, but they would then get that January and February rebates as a part of their March bill, or if that eliminates it, they get it in the next one. So they would be assured they're going to get the full year's rebate. It's just going to be delayed until they can, the health plans have to set this up and implement it.
So any delays, for instance, if it gets passed at the end of the month or even next month, would push it out to the following month?
They would if they delay it further, that's right. But if you know they're going to receive it, if it's passed in law, and they know it's going to be there, and they can be informed by us and by the health plans what the situation is, and that they'll receive that full credit for the first 2 months, then I think they can factor that into the determination what kind of health insurance they're going to buy.
If I could on that one, again, one of the key points is that open enrollment does end on January 31st. So if we don't get this done and give people the certainty that this financial assistance will be there, there are going to be, some number of people who opt to just pay the tax penalty instead of gaining coverage. And, one of the things that we did accomplish was 96% of Minnesotans are insured. That's a really big deal. That's the largest number of insured that we've ever had. And we don't want that to erode. And that is, if we don't pass this rebate, there are going to be, some number of people, unknown right now, who will opt to not purchase the insurance because it is out of their reach. And this rebate will hopefully bring a great deal of additional stability to the market.
As a follow-up on that, you say unknown number of people. Are we talking about dozens, hundreds, thousands of people who might not get insurance because they don't have this rebate?
It's really hard during this open enrollment period to actually speak with any precision, but it would be thousands, I would imagine. I don't know how many thousands.
And just, next round.
Yeah.
I don't want anybody to break their neck the first day. MNsure enrollments so far have been 57,130. And through MNsure, a number of people found they were qualified for Minnesota Care. So they, an additional number of 17,850 people enrolled through MNsure in the Minnesota Care program. And similarly, as 57,920 found that they qualified for medical assistance. And so that number has been added as well. So the total additional enrollment through MNsure since November 1st has been 132,900, and the average wait time right now is 0 seconds.
Governor, this is relief without reform, spending without redoing what Republicans say is broken in a major way. Are you open to an overhaul of MNsure and the way it operates?
I'm open to any suggestions, and the same in Washington as here. They've criticized it in Washington. Some of the corrections that could have been made prevent some of these problems. Were no-goes in Washington. The Republican House voted over 50 times to abolish the Affordable Care Act, not to try to improve it. So, it's incumbent on them now in Washington with a Republican majority and a president to say what they're going to do to improve the existing system and not lose the benefits it's provided. And we'll have to wait and see how they proceed on that. And similarly here, there are steps that we can take at the state level, even within the existing Affordable Care Act statute, to improve the situation here in Minnesota. And I'm all ears, and I want to hear from legislators as well as from the health plans and from others who are stakeholders in this, what they recommend can be done. Now, we have to act, and Speaker Dowd had mentioned this in our lunch, we have to act within the first probably 2 months or so, because the health plans are going to start making their determinations of are they going to stay in the individual care market and offer coverage. Blue Cross Blue Shield pulled out. That had major consequences for this year, as well as what their premium rate increases are going to be. So they need to know what the landscape is for 2018. And I'm sure the legislature can accommodate that. I intend to work with them to do so.
Yeah. Thank you. So one thing I'd really like to be very clear about, this is not a MNsure problem. I think there's a great deal of confusion among the public. I think the press sometimes confuses the issue as well. This is a problem in the individual insurance market. MNsure does not set rates. In fact, MNsure is part of the solution here because many people, if they bought their insurance through MNsure, would in fact get some help paying those premiums through the premium tax credits. And At one time, it was estimated, I don't know if this is still the correct number, but 100,000 Minnesotans would be eligible for that help and aren't getting it because they're not buying through MNsure. So please, let's not call it a MNsure problem. We know that MNsure has had some problems, but those are separate. This is not about MNsure. Secondly, it is clear that this proposal is just a temporary fix. None of us ever pretended it was anything else. The question was, could we make big reforms to the insurance market in a special session without any real public input, without any real vetting? And the answer to that was clearly no. So when the Republicans came forward and said, we won't do the rebate unless you do all these reforms, that was really a smokescreen for not doing the rebates. The rebates are there to buy time so that there can be a discussion with the public, with the stakeholders, around what can we do to really reform the system going forward. But the reforms that we're talking about are not MNsure. I just really want us to be clear about that, because I think that sometimes is purposely put forward by the Republicans, because you all know that they've been for all the time bashing MNsure. MNsure, 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 it's evil, it's terrible, we should drown it in a bathtub. That's what they have been saying. And that's just a smokescreen. They never did anything to try to deal with the problem in the individual insurance market. So I just ask you all to be very clear about that distinction.
As a follow-up on that, you said the 100,000 figure. How many of the, I think 57,000, are eligible for the tax credits?
Okay.
All of the people, sorry, are all the MNsure enrollments, how many of them are eligible for the federal tax credit?
Over 60%, I believe, is the current number of the 57,000 that are coming through MNsure are receiving federal tax credits, and it's over $600 per month is the average tax credit that people are receiving right now.
I mean, because of the rate increases, there are very significant benefits from the federal tax credit. I mean, they've gone up significantly with the premium price increase over last year. So people are getting a major reduction in that increase in the premiums who qualify under the federal act, and those who don't, if we pass this, so we'll get a similar benefit.
If I may, the President-elect this morning used your words against you and prodding Congress to try and come up with some changes on national health care. Helpful discussion? Not helpful to discussion? What are your thoughts?
Well, I've said before that the Affordable Care Act is no longer affordable to an increasing number of Minnesotans and other Americans. The President has basically said the same. I mean, the unintended consequences of Affordable Care Act as it stands now are these significant premium increases for some people, not for everybody, and the lack of continuity of care and the inability of people to be able to keep the doctors that they've had up until now. And those are serious problems which Congress needs to address, and we will do what we can at the state level as well. So I stand by that statement, and it's crucial that we go back to restore that promise of the Affordable Care Act, both the affordability and if you like your doctor, you can keep him or her.
Governor, what's the Republicans in this whole process say that we need to have an outline first of long-term reforms before we proceed with the rebates or the temporary fix, as it were. What's your attitude on that?
Well, I'll wait to see their outline. And we're going to come forth with our proposals in the course of this month. But, they've been bashing, as Representative Liebling said, MNsure for problems that are really beyond MNsure that are subject to the Affordable Care Act. Congress has been bashing the Affordable Care Act for the last couple of years rather than making the improvements that could have reduced some of these premium increases. So now the Republicans, they've been against it. They, capitalized it in their campaigns this last November. Now it's their responsibility to take leadership and say what do they want to change it to. In Washington, they're talking about waiting 3 years because they don't know what they want to do. They know they're against the Affordable Care Act. They can vote to eliminate it, but they don't know what they want to replace it with. And, just throwing it back into the old, every Darwinian process where everybody's fending for themselves and trying to decipher insurance plans and then finding out after it's too late that they're not covered for what they thought they were. I mean, that's not what Americans want to go back to. Over half the personal bankruptcies in America were caused by people who couldn't afford their health insurance, their health care costs, and most of them were insured. So the gaps in protection for Minnesotans and other Americans before the Affordable Care Act were severe and growing. And again, pre-existing conditions. I mean, before that, people couldn't get insurance if they had pre-existing conditions, which as you get older is almost a certainty. And so there are huge reforms here, in addition to the affordability of insurance, that the Affordable Care Act has made, that the Congress is going to need to decide whether they're going to continue or not. I hope they will. I urge that they do.
Do you have your administration working on reforms, and are we going to see a major proposal to the individual market or to MNsure so that this problem...
You'll see a proposal, yes, this month.
In your budget?
In the context of the budget, because some of it has budget implications. But the other, major recommendation I have is for Congress, which I'll expressing to Representative McCarthy. He had asked for the House Majority Leader for suggestions from governors about how to improve the Affordable Care Act or what to replace it with. We talk about reinsurance, and where the state would buy the increases or would pay for the increases in insurance above a certain amount. I'm not saying that very well. It would basically be catastrophic coverage by the state, as they've done in Alaska. That needs to be done at the federal level. It's prohibitively expensive for Minnesota to do that. It's about $500 million a year to provide that kind of reinsurance. So say if there's a claim above a certain amount, pick an amount, then that will be covered through this common pool of funds. That means every insurance policy for everybody, not just the individual market, employer-provided insurance, everyone else can go down because these insurance companies don't have to hedge with every single policy against these kind of catastrophic claims. That was proposed when I was in the U.S. Senate over a decade ago. I don't know why it hasn't been followed up on, but that to me is the single most significant reform that would benefit this entire country, would benefit as I say, people who buy their coverage individually, get it through their employer, and benefit the employers, reduce their costs. And that's the one I think is the best single remedy that could be made to the existing system.
Understanding how you feel about all of this, and you've been very clear over a number of years about the healthcare reforms, what is your reaction to being a national target of Trump's tweets as a reason to change it and overhaul it and repeal it?
I don't have any control over what the president-elect tweets. I mean, I've stated my position, and I never said that it was lousy health care. I don't know, that wasn't part of the quote, but he put that in. That was that's his view. I mean, I'm all this stuff. I don't tweet. That's everyone wants proof positive. I'm not running for another office ever again. I don't tweet. So I don't follow them on a minute-by-minute basis. But whatever he says is his prerogative to say.
Governor, and maybe Tony or Tina, why the resistance to letting out-of-state companies sell policies here, or international companies sell health policies in Minnesota? That apparently is one of the reforms, one of the policy reforms Republicans are trying to get wedged into this relief bill.
Well, I'll just say before I turn it over to them, that's not objectionable. They have to meet the standards we have in Minnesota and that the Affordable Care Act has for the quality of insurance they need to provide. And that's one of the critical variables there.
Well, and I think it is time for that discussion, but it needs to be a broader discussion about how that works. I mean, if we're going to switch to a for-profit health insurance model, we should talk about the reserves that our nonprofit health insurers have right here and have a sort of a plan for how to use those to buffer against some of the changes that would certainly come. And it's a bigger topic than can just be plunked on the table, and truthfully, and passed without a great deal of discussion. And it might not be the most effective lever that we have, and we should be willing to listen to our healthcare community in terms of what the best levers that we have for stabilizing the individual market are. I'm not I'm not necessarily opposed to that. I think it is past time for that conversation, and I welcome it, but it needs to be within the context of a broader conversation for the future of the individual market.
Yeah, so not surprisingly, Representative Lourey and I agree on that. I'm not sure there is opposition to it, but could you plunk that down and have it pass in a special session one day without any real discussion, without any hearings, without any vetting? That's what Kurt Dowd was proposing to do, and the fact that the governor wouldn't do that was his excuse for not passing the rebate. So this is just an example. This is, it may be, I suspect that no private insurers are going to want to sell because they're telling us they can't make money. So then the solution is let somebody come in and make money. I don't know how that works, but I am open to that. And if somebody, if there's testimony that this is something that's going to help Minnesotans, help them be covered, help them, most importantly, help them get the health care they need at a price they can afford, then I'm all ears.
And I would just second and repeat, I'm all ears as well. All ideas and constructive suggestions to improve are welcomed. And that's the opportunity that the legislature will have, and I'll be part of that over the next couple months.
Anything else on this topic?
Governor, Federal Appeals Court has overturned Judge Frank's...
Is anything else on this subject? Then I'll go to that. I'll go to you right away. Anything else on this subject? Okay. Well, you're welcome to stay around, or you can get out of the line of fire. Most people will stay.
Governor, Federal Appeals Court,
thank you both.
has overturned the sex offender ruling by Judge Frank. Will you react to that and tell us what it means for Minnesota?
Well, just received that information, so I haven't had a chance to review it with Commissioner Piper or to really assess it, but my understanding is they ruled that the Minnesota system now is constitutional, and that means we can continue to make the reforms that we have started at our own pace and at affordable costs to our state budget, rather than having it be done under a federal directive. So I'm very glad that we received that ruling from the 8th District, and it doesn't mean we can go back to just letting people be locked up unattended for lifetimes, but it means that we can proceed apace as best serves not only the institutions, but also the general public.
Will any changes to that program be part of your budget proposal this year?
Yes, there'll be continued reforms, continued improvements for both the evaluations of people who are presently in the sex offender security sites, as well as the real problem we have, or one of the problems we have, is we don't have alternative placements for them, and that's expensive. And I don't know, the legislature did not want to see that in the bonding bill last year, and I don't think they'll be any more enthusiastic about it this year. So part of it, and it's true of more broadly, our mental health situation in the state right now is overwhelmed with people. There's a private hospital in Wilmer where they have people coming to the emergency room with mental health issues. They need to stay up to 30 days. They've had to set up a residential wing in their emergency room to accommodate these people. There's nowhere else to send them. And the jails are full of people, as Sarah Stanek and others say, are mentally ill. And there's nowhere to send them. Anoka is full to capacity. There are people who could be moved out of Anoka to less secure residential settings, but there's no places for them. So the whole system is totally overloaded and as a result, overwhelmed. And, but remedying all that is expensive, and it's going to be quote-unquote government spending. So we'll have to see how that fares in the legislative process, but I will be making recommendations.
Governor, does the lack of pressure from that lower court ruling make it even harder to get these improvements?
Well, that's a good point. And yes, I think it means we're back to our own initiatives. I don't see it as a reason to stop what we're doing. I think it means that we can proceed at a pace that we can afford and that we can manage. These are people that are still at very significant risk to the general public, and we need to be very careful about how they're reintroduced to society and the protections that the law-abiding citizens have as they're walking down the streets or going about their business, and God forbid that we should have a recurrence of something that would be just catastrophic. So I want to proceed very cautiously, and I'm glad that we'll be able to exercise that caution and without federal jurisdiction.
Governor, in your forthcoming budget, is universal pre-K going to be another objective added transportation fund?
Well, I'm not going to, geez, I got 3 more weeks now, you know. I'm not going to, you know, well, stay tuned. There'll be increased funding for early childhood education, for pre-K, for quality child care, for home visits. There'll be a combination.
Governor, what's your relationship with the Speaker of the House? It appears from the outside to be there's animosity and you're polarized. Is that accurate?
Well, we had lunch last week. I invited him to lunch, and just 2 of us, and we had a very cordial conversation. I mean, we had a dust up in a public setting with somebody's idea to have these meetings in open rather than behind closed doors. That person will soon be dispatched to Nova Scotia. You know, that particular event was not indicative of the relationship we've had throughout the last 2 years, and it's not, in my mind, indicative of the relationship that I believe we'll have over the next 2 years. We have our differences. You know, he represents a caucus that has very different views and ideologies than I have, and you know, we're institutionally we're going to clash, and that's part of democracy. But we'll do it in a mutually respectful way. I met with Senator Gazelka. I had him and his wife and his youngest daughter to lunch with Lieutenant Governor Smith and I with the residents a couple weeks ago. A very cordial relationship there. I've known him not well, but worked with him on other projects. I have very high regard for him, and as well as Senator Bach and Representative Hortman. You know, I'm willing to be as congenial as I can be, but I learned in 2011 there's a limit to where that congeniality runs up against this very significant ideological and policy differences that we have, and those are genuine. And the people of Minnesota knew that when they sent the 201 legislators, and I guess 200 now, and myself to St. Paul. And so, you know, we got to work it out. We have to, especially on a budget, we have to work out by the end of the legislative session. And I hope after the experience of 2011, we'll all have learned that lesson, and we'll be willing to make the compromises necessary to do so. But I don't think it's going to be easy. I've said all along, I think this is going to be a very contentious session because we have these very significant differences, and people in Minnesota have those differences among themselves. So we're going to have to find a way that we can reconcile those as best we can. It's going to take 5 months to do so.
You had a shutdown last time when Republicans controlled both of these. The state government had a partial shutdown. Are you willing to do that again?
Well, in the beginning of May of that 2011, we were $3 billion apart on the biennial budget. And I came down $1.5 billion, and I said, I'll come to the 50-yard line. I'll wait for you to join me at the 50-yard line. And they didn't budge out of the end zone. So we had the shutdown. Their solution was to borrow $750 million from the schools, more money from the schools than from the tobacco fund. So they put the state into further fiscal arrears so that they could have their no tax increase mantra preserved. I mean, if it takes 2 to tango. I'll meet halfway on the budget, but the other folks have to come up halfway too. I'm not going to go all the way down to there, especially with the consequences that those kind of cuts have for education, for health care, for transportation, for everything. This is not about padding government. This is about providing the services that government needs, providing the financial assistance that the Minnesotans need. And that's what my focus will be.
Governor, now that you moved back into the renovated Capitol, are you personally in the historic governor's office or some kind of...
Yeah, I've come full circle. I'm in the office that Governor Purvis was in. And 2 of my wonderful staff people, scheduler Katie Pauly and Jenny Mace, my person who has the intact young brain cells to make up for my deficiencies, are right adjacent. So, and I lost my little cubby over there, but it's now a stairwell. So, but, you know, yeah, I'm in this one right here.
What do you think of the new state capital already?
You know, I've really not walked around. I haven't seen much, really anything other. This is the first time came twice last week just to look at my office, but I haven't done the Cook's tour, which I look forward to doing at some point. I'm glad we're back. 2.5 years is a long, long time. I'm proud of the legislators and everybody involved, including myself, who were willing to do what was necessary for the long-term benefit of this building and for the people of Minnesota, and endure those disruptions, and all of you as well, to endure those disruptions, especially the last legislative session. I'm glad we're all back together, and I think this building will, from all accounts, serve people in Minnesota very well this year and for many, many decades to follow, which is the point of the effort.
Any other questions?
Chairman Dayton, return to the subject of what I would call political dysfunction that we've seen in the last few weeks. Senator Bach told me that, acknowledge the obvious, that you two have had some problems over the years, but he found that you are somebody who's open to meeting somebody halfway. Speaker Dow told me that he doesn't hold grudges and that the controversy won't continue unless you do. Is Senator Bach right?
Yeah, I think he's right. I mean, I've been doing this for 40 years, clashing, especially reflecting the different constituencies, different ideologies, different sincerely and deeply held views about what is best course to take. And that's part and parcel of democracy. And that's the reason we're brought together here, is to have that clash of ideas and ideologies and the like, and to then resolve those differences. I'm able to separate those differences on policy or statute from the personal side of things. I don't take things personally. I've been called names for 40 years, and people are welcome to continue to do so. So, you know, but my job is to do what I think is best for Minnesota and to stand up and hold firm for what I think is best for Minnesota. And the Speaker's job, Senator Gazelka, Senator Bach, their job is the same. So when those jobs conflict, then we have the part that gets all of the attention, and when we work cooperatively together, it gets zero public visibility, but you know, that's still the norm, and it needs to remain the norm, and I'll do my part to make it continue to be the norm.
Tomorrow, you're going to address the Minnesota Chamber. Are you open to any sort of business tax cuts?
I'm not going to get into the details of, I'll have a tax bill actually at the end of this week, so stay tuned for that one too. I got this bill today, tomorrow issue, as I said I would the first week, about my bonding proposal, and then on the Friday or Thursday? Thursday, my tax proposal.
May we expect a robust bonding proposal?
Yes. Robust is a good word. We'll leave it at that for today. Okay?
Thanks, everybody.
Thank you all.